Protect mental health, be the self-starter. Series 4. COVID-19, beating the path to recovery in mental health. To stay or to quit. The International Labour Day has passed. Have you taken the opportunity to get a long holiday for rest or vacation with your families or friends? How do you feel when you return to work after the holiday? Excited? Full of energy? Or tired, agitated, or even panic? If you have been feeling exhausted or even burnout for a period in the workplace, and wonder if you should stay or quit, we suggest that you reflect critically on the following for making an informed decision. Identify the psychosocial risks in the workplace. Address the signs of burnout. Reflect on the thought of resignation. Take action to address the risk factors. Mental health at workplace. According to the recent Mind Health report by E.A.P. 2024, the mind health issues are globally on the rise, and young people, aged between 18 to 24 years old, have been hard hit by the COVID-19 pandemic over the past 4 years. About 40% of these young people are experiencing severe anxiety, stress, or depression. 3/4 of the working population in their study have at least one mental health problem related to work. Recently, the Hong Kong Federation of Trade Unions, FTU, Youth Committee released their survey on the work stress of youth workers. The survey revealed that 85% of the respondents, aged 25 or below and with 2 years or less of working experience, indicated that they felt stressed when they first joined the workplace. About 60% have thought of quitting their jobs due to work pressure. When under work pressure or emotional distress, about 40% of the respondents stated that they were unwilling to seek support. We should not overlook the problem of mental health in the workplace. Working people of all age groups should address the issue, the sooner, the better. To stay or to quit, making an informed choice. How can we make an informed choice of staying or quitting? We may reflect on the following 4 aspects. 1. Identify psychosocial risks in the workplace. Based on the 10 categories of risk factors for mental health in WHO Guidelines on Mental Health at Work, WHO, 2022. I further grouped them into 5 broad areas to help us critically reflect on our current work environment. A. Nature and control of work. Work content, task design, lack of variety, short work cycle, fragmented or meaningless work, high uncertainty, continuous contact with people through work, etc. Workload and work pace, work overload or underload, time pressure, continual subjection to deadlines. Work schedule, shift work, night shifts, unpredictable hours, long or unsociable hours. Control, low participation in decision-making, limited control over workload, pace. B. Environment and equipment. Inadequate equipment availability, inadequate workspace, excessive noise. C. Organizational culture, functions, roles, and communication. Poor communication, low support for problem-solving and personal development, lack of organizational goals or consensus, intense competition for scarce resources, over complex bureaucracies. Interpersonal relationships at work, isolation, poor relationships with supervisors, interpersonal conflict, lack of social support, perceived or actual, bullying, harassment, mobbing, aggression. Role in the organization, role ambiguity, role conflict, responsibility for others. D. Career development. Career stagnation and uncertainty, lack of promotion, low pay, job insecurity, low social value of work. E. Homework interface. Conflicting demands of work and family, including people with caring responsibilities, inadequate family support, dual career problems, living away from family during work assignments, living in the same place where work is done. Let's pause and reflect if we are prone to those risk factors and try to find ways to address the conflicts that pose threat to our mental health. 2. Attend to the signs of burnout. According to the Mental Health Report by E.A.P. 2024, we tend to overestimate the quality of our mental health and do not recognize the severity of our situation. The report stated that 7 out of 10 people are suspected of suffering from depression, anxiety, or stress at severe level, but they still considered their mental health to be good or average. This seems to reflect that there is enduring lack of awareness of mental health issues. We need to raise our awareness of our mental health and by using the self-assessment tool provided by the Department of Health, we can help ourselves to understand our current state of mental health. 3. Reflect on resignation. To quit or to stay in our current position, this is the moment of taking our responsibility to address our needs and a sign of maturity to hold accountability to our mental health, career, and work-life balance. When the decision is made after careful deliberation, to stay or to quit, it is the most appropriate decision now. However, if we are in emotional distress, it is more appropriate to bring our thoughts and feelings to sharing with our trusted family members, close friends, seniors, and/or professional counselors. 4. Take action to address psychosocial risks in the workplace. Once decision is made, we need to continue to learn how to address the psychosocial risk factors in the workplace and empower ourselves to accept challenges along the career. For example, we need to enhance our communication skills, stress management, conflict resolution, and self-care. In addition, we can make effective use of the Employee Assistance Program, E.A.P, if provided in the workplace, which aims to empower us on addressing problems we encounter in the workplace. Conclusion. When we can identify the psychosocial risk factors in the workplace, address the signs of burnout, reflect on the idea of resignation, and take action to address psychosocial risks, we can turn a crisis into an opportunity. The choice to stay or quit becomes a valuable lesson in our career life. Author, Dr. S.P. Chan, Doctor of Psychotherapy and Counselling, the University of Edinburgh, UK. Master of Science in Mental Health, the Chinese University of Hong Kong. Master of Science in Psychiatry, Cardiff University, UK.